As the world becomes more consumer-oriented, so does healthcare. Three experts discuss how provider organizations can create hyper-personalized experiences for the patients they serve.
Now, I see it as an N of one experience. So where my care experience is tailored to my unique background, preferences, and circumstances. It's the idea of know me, connect with me, and orchestrate my care. So know me much more than what my clinical record says. Take into consideration my decision-making patterns, my preferences, and my behaviors, perceptions as well. And then connect with me in a way that's relevant and meaningful to me. And then orchestrate my care in a way that's predictive and proactive based on all that you know about me.
So a very important aspect of hyper-personalization, I feel, is also a focus on experiences. But almost every human interaction we have is an experience. And once we understand that even in healthcare, someone will want to be delighted by an experience, right? And is happy at the end of it because of the way that they're treated. And even more so, I feel, in healthcare. So I think it's very, very important for us to focus on delivering really great experiences that both heal and delight in healthcare. I think that should be one of the goals of hyper-personalization.
So traditionally, we've thought of things in terms of that clinical interaction, that clinical experience. But with hyper-personalization, we're seeing that there are other factors of that consumer journey that are just as important, if not more so, than that clinical interaction for the consumer. It may be the time that they wait for an appointment. It could be the way that they're treated upon arrival. Maybe it's the technology that's provided as part of the virtual care app. All of these factors are potential friction points or potential areas that you can win in hyper-personalization. Consumerism is really the responsibility of everyone within a healthcare organization. What we've seen is that the IT, patient experience, and marketing teams are the best ones to come together and lead the charge. In fact, in many of our cases, we're seeing that the responsibility for consumer experience is really a combined function between marketing and patient experience. And then they are leveraging the IT team to create those digital points of contact along that journey.
So this requires both first-party and third-party data. First-party data is data that you own, clinical data, financial data, marketing data, and bringing all of that together. So not just what care plan this person is on, but what does their insurance situation look like? Is the prescription too expensive for them given the plan that they're on, and they're likely not to take it? Do they not have a car, which will make it difficult to get to their follow-up appointment? And then marry that with third-party data about that individual, social determinant data, psychographic data, things like motivations, perceptions, behaviors that impact care. For example, is this a single mom who's more comfortable with female clinicians, or another individual whose work schedule only allows them to make appointments after hours? How can you marry all of these data items about a person to deliver that hyper-personal care?
I think also as we look at these internal sources of data, we will start to develop other types of secondary data sources internally that organize this data in a meaningful manner, like maybe a customer or consumer data platform that we build, and then universal IDs for patients across our organizations so that they don't feel like they are being treated as a different patient if they cross over to other groups in our organization.
You know, it's interesting. So many healthcare organizations have tons of technology. There is AI that marketing is using to understand brand sentiment. There's billing software that the revenue cycle team is using. You've got all of these different pieces of technology. And in the past, we've treated these as separate items with separate stakeholders. Moving forward, we really have to look at technology as a single ecosystem. And in order to make something like that happen, you should challenge your technology partners. You don't have to solve all of this yourself. By working with the partners that you already have, presenting them with a problem, they can often come up with a better solution than you even thought was possible. And challenge your technology partners to work together with each other as well. And you'll get a lot more out of the technology that you've already invested in, and also be able to identify technology that maybe you don't need anymore because it doesn't meet today's need.
I think as we learn from other industries too, there are specific industries that we need to focus on, not just healthcare, but other industries like retail, for example. Retail has been in this hyper-personalization space a lot longer than healthcare has, right? And I think there's lots and lots of lessons that we can learn from there, but also that we need to apply to our very nuanced space of healthcare. That's also highly regulated, right? So I think we should reach out beyond our industry, understand what consumers currently see in other industries. Remember, that also bleeds into our industry. An expectation there can become an expectation in healthcare too. So the more we understand about how consumers access hyper-personalization in other industries, I think the better it will be for us to develop ourselves on our journey towards hyper-personalization and care.
In the midst of all the firefighting right now during COVID, we need to think ahead. We need to think about a couple of years down the line. And I would say start small. Start with small things like appointment reminders. Start with small things around patient engagement and bring those to a personalized experience. And then you can build on that.
Whenever we're asked how to start this, we always tell our clients that the best place to see the most return on your investment is to invest in anything that helps you to be more visible on Google or helps the consumer to take action on Google. More and more, we see that consumers are taking action in mobile or using the Google Knowledge Panel, and fewer of these consumers are actually taking the initiative to go to your website. So if you can enable that action and that conversion and drive the information gathering for the consumer right there within the Google results that they receive in their mobile device, you'll be a lot closer to delivering a personalized experience when and where the consumer needs it.
As with most industries, healthcare is also an industry that is resource constrained. We can't just do everything that we want to do, and hyper-personalization requires a lot of work to get started. However, I think we shouldn't try to make this perfect at the outset, and try to do everything on this hyper-personalization journey. Typical 4 stages of a patient's journey of discovery, access, engagement, and loyalty. We can start building solutions towards hyper-personalization in each of these areas, prioritize them by the needs of our organization, and take inspiration from the physical space. There are lots of clinicians and providers that provide hyper-personalized experience just at the personal level. This may be a front desk assistant who just treats their patients with so much care, sends them a wheelchair downstairs if they knew from the last time they had trouble getting to the office, or remembers their birthdays and calls them just out of the blue that way. So I think those are physical and human experiences that we need to start building into maybe a more technological or digital space so that everyone can access them and everyone can be sometimes more human in this hyper-personalized space.